Yo, welcome back, Dental Lighthouse Podcast. Got a question from an awesome doc in the DSI group. For those of you guys that don't know, DSI is the Dental Success Institute. Dr. Mark Costas's really great group of clients and black belt coaches, of which I am blessed to be one of. So I love to help people in the DSI mastermind. And someone had asked a question in our group, and then I was tagged to formulate a response, which may or may not be a good idea, but I'm going to try to formulate a response anyway. So I'm going to read it here for you guys. Uh, Hey guys, I would love to hear some thoughts. We have an issue with a hygienist that's been with us for almost a year. We hired her straight out of school. The lead hygienist and I brought her through onboarding and calibration. Like many new hygienists, she was underdiagnosing perio and leaving subgingival calculus. We worked with her and things improved for a while. Now it seems that she has regressed. This person is a great culture fit and a nice person, maybe a hyper conscientious person. I feel like some part of the issue is related to conflict avoidance, not wanting to deliver bad news to patients and fear of hurting people while she is scaling. Our hygiene team does great clinical dentistry, and they are starting to feel that she is not holding that standard. My thought is to put her on a performance improvement plan. We would go back through some of the onboarding in terms of perio calibration. We would require before and after scaling x-rays. I'm open to any suggestions. I feel that she has the knowledge, but I'm not sure how else to lead her to success. This is awesome. This is a super good question, and I just love the humility in the question from a perspective of, I'm the doctor, I'm the owner, but I don't know like what the best way to proceed here is. So I can share some thoughts, realizing that there's probably a lot of different ways to answer this question correctly or this concern correctly. Um, just some of the things that are rolling around in my head, some of the things that I think you should consider, and then we'll go from there. First off, I'll just go through this list here. Um, he says, like many new hygienists, she was underdiagnosing perio and leaving subgingival calculus. I think I'm not 100% on board with that statement. Um, I feel that we have hired new hygienists out of school that are super dialed in for diagnosing perio, and then other ones that are, to your point, underdiagnosing. Same thing with their clinical skill set. Some brand new hygienists are amazing at dealing with subgingival calculus, and some are not. It really just depends on who the person is, the mentorship that they had when they were in school. So I'm not crazy about that gross generalization, but in your particular case, if you have a new hygienist that's underdiagnosing, let's tackle that one first. So how are you guys calibrated, right? And I throw around this term calibration a lot, but it sounds to me, based on this message, that your hygiene team is well calibrated. So you're welcoming this new hygienist into your hygiene team. The rest of the hygiene team is fairly dialed in on what classifies as health, what classifies as gingivitis, and what classifies as periodontal disease. Again, you may have different terms, but at the end of the day, those are really the three things that we're talking about here. Is the patient healthy? Does the patient have inflammation without attachment loss, gingivitis? Does the patient have inflammation, infection, and attachment loss? Some level of periodontal disease. So if you have coached this person up on how best to make that diagnosis, and there's a number of ways, right? Obviously, most people will go to periodontal probing, which is a great tool. You can use x-rays to look for attachment loss. You can use a microscope to look for anaerobic or aerobic bacteria. You can consider bleeding points. You can use artificial intelligence like Overjet or Pearl to help you with the diagnosis. So getting calibrated as to how to make the diagnosis is one thing. The other thing is now being able to communicate that diagnosis to the patient. And that's hard to the point of your message, right? But why is it hard? It's hard because a new hygienist, someone that is doesn't have a ton of experience in having uncomfortable conversations, to your point, may not want to have conflict. They may be more interested in conflict avoidance. The question that I would ask you, and I know you understand this, and more importantly, the question I would ask the hygienist, and I ask this question a lot when it comes to leadership, right? When it keeps to keeping people accountable, who really benefits when we do not keep people accountable? So in this situation, when this hygienist is not being held accountable to meeting um, your standard when it comes to periodontal diagnosis and treatment plan, there's really only one person that benefits, and it's the person that's getting to avoid the conflict, right? It's this hygienist. So let's look at it from the patient's perspective. Is the patient benefiting from their hygienist, their clinical advisor, their expert that they're going to? Is the patient benefiting at all from not being told they have periodontal disease? The answer is obvious. No, there's absolutely no benefit. Does the business benefit from you having patients that have active gingivitis or periodontal disease and they're not being diagnosed and they're not being treatment planned for the care they need? Absolutely not. So we've already determined that the patient's not benefiting. We've already determined that the business is not benefiting. Who is benefiting here? The only person that's really benefiting is the hygienist, because she gets to avoid having the uncomfortable conversation. And I don't want to sound like mean, but that's the truth. I'm just being honest. Now, the hygienist doesn't want to have that conversation, not because they're a bad person, but because they haven't been coached up on the benefits of having these uncomfortable conversations. This hygienist, in my opinion, needs to understand that they're a professional and patients are coming to them not for the great conversation, not to get away from their kids for an hour so they can watch a soap opera on the television on the screen. They're coming to their hygienist, their dentist, their dental office for health. They're coming to the appointment to proactively maintain their oral health. And as we're now learning, their overall health with the oral systemic connection. So if we have someone that is actively seeking us out for health, yet we're not proactively delivering news that the patient is unhealthy, then shame on us. Shame on this hygienist, or shame on us as owners for not coaching this person through it. Now, again, I'm not trying to throw you under the bus, because I know that the fact that you're asking this question from a position of humility tells me that you want to do the right thing. You just are struggling with how to do it. And I get that. And I've been there, right? As a young doctor, I would routinely not diagnose what the patient needed for fear of um, having them be upset with me, or having them fear of rejection and having them say no. And through experience and through seeing my own failures when it came to avoiding these conversations, I've come to the realization that as a health professional, one of my main jobs, if not my number one job, is to communicate to the patient what their condition is in the most empathetic way possible, right? Active listening, trying to hear about their situation. But at the end of the day, I have to do my job and communicate to them what their health clinical situation is. Okay. Now, I have guilty of this, and my hygienists, I have some hygienists who are guilty of this, of they know the patient has gingivitis, they know the patient has mild perio, but they also believe that the patient can't afford treatment, or they also believe that the patient doesn't value the treatment. That's not our concern. It's not our concern to psychoanalyze if this patient can afford treatment or if this patient is going to value treatment. Our job is to communicate what the diagnosis is and what the treatment recommendation needs to be, and then allow the patient to decide what they ultimately want to do. Now, if the patient says no to treatment, you'll have to have systems in place that allow you to navigate those waters. But again, just to kind of come full circle here, our job is to make the right diagnosis. Are you providing your hygienist with the tools to make the right diagnosis? That's the first thing. Secondly, our job is to make the right diagnosis. Do your hygienists feel empowered to be able to make the right diagnosis, because it's ultimately their responsibility as a healthcare professional to not mislead, to not misguide, to ultimately tell the patient what they ultimately need, right? Do they have the tools, and are they comfortable enough having that conversation? Do they understand why it's so important for for them being a trusted healthcare advisor to tell the patient what they ultimately need? That's the first thing. As far as the second part of um, fear of hurting the patient, or fear of not removing subgingival calculus because of discomfort to the patient, that's a tough one, right? That's a really tough one. I think it comes down to, from my perspective, their clinical ability, which is part of it, and their ability to continue to get better with their hand scaling. But the other part of it is, if there's subgingival calculus, you cannot be taking care of a majority of that at a traditional recall appointment. The patient should be either numb with a topical or numb with traditional anesthetic, and they should have the subgingival calculus thoroughly removed. So when a hygienist says to me, um, I fear that I'm hurting the patient, which is a great fear. I love that fear, right? Is it because the diagnosis was wrong? Is this patient scheduled with you for a recall appointment, and there's 50% of their mouth has subgingival calculus that you're trying to remove during a recall appointment? If that's the case, then the diagnosis was wrong and the treatment was wrong. We go back to calibration on the diagnosis, right? You need to be able to have that conversation with the patient, and it could be years of neglect that you don't want to have this conversation. I get that. But the reality is, what a blessing to now be in this situation with the patient and be able to be a 100% honest with them and say, look, you've had years of subgingival calculus accumulate, and now the buck stops here. I am going to fight like hell to get you healthy. If that means that we need to go through some type of periodontal therapy, if it means we need to go through some type of gingival therapy, if it means we need to use topical anesthetics or traditional anesthetics in order for me to do a great job and do it in a way where you can be very, very healthy, then let's do that. Because no one is benefiting from you having this subgingival calculus, this subgingival tartar, and me just scraping a little bit over here, scraping a little bit over here, you not having any discomfort, but the reality is me not really benefiting you at all. You still have this underlying infection, you still have this underlying inflammation, and no one really benefits. So I hope I answered your question there. So actually, let's just finish this with one more thing. So what should we do? Like in this particular situation, what should we do? First thing I would do is communicate the why, right? Like, why is it so important to go into the storm to have an uncomfortable conversation with the patient when they have some level of inflammation or infection or uh, something along those lines. Right? Why is it important to not turn your head to the fact that there's active things going on? Okay, that's really important, and you can tie it back to oral systemic stuff. You can tie it back to they're trusting in your opinion and your care because you're a healthcare professional. That's the first thing. Go into the storm, go into the conflict, right? Because it's ultimately benefiting the patient. I would again reiterate, when you do avoid conflict, who does it benefit? Again, not the patient, certainly not the business. It only benefits the person that's getting to avoid the conflict, which, I hate to use this word, but it's true, is selfish, right? If if you don't want to hold someone accountable, even though you know it's in their best interest to grow, and even though you know it's in the organization's best interest, even though you know it's in the team's best interest, if you're going to avoid that conversation, then that's selfish. Shame on you. Okay. Um, so those are a couple whys. Now, in terms of the performance improvement plan, which again I think is great, um, I think having a more experienced hygienist or doctor check their work makes a ton of sense. If her skill set is struggling, if her skill set is dialed in and she's just not wanting to perform what needs to be performed for fear of making someone uncomfortable, again, that kind of goes back to the wrong diagnosis was made. I'm a huge proponent of preoperative and postoperative vertical bite wings for scaling and root planing appointments. I have hygienists that have been doing this for over 20 years. They still routinely do that. There's nothing wrong with that. It's like a post cementation bite wing. Like, I've cemented 1,000 crowns. I still take a post cementation bite wing because you never know, right? There could be a little piece of cement that I couldn't get, or in this particular case, there could be tartar that was in a furcation that you didn't see. So I am a huge proponent of that. More importantly, though, I think I'm a bigger proponent of a mentor, either the doctor or a senior hygienist, spending 10 minutes with that younger hygienist, verifying their work, checking the work, and then teaching in the moment of, wow, this is a really tough area to get. Have you tried using this instrument with this hand motion, right? And then the young hygienist, if she's a good core value fit, like you said, would be soaking up that mentorship like there's no tomorrow. And that it'll ultimately collapse time for her and get her to where she needs to be. So I know I just rattled a lot of stuff there. Hopefully some of it resonates. Hopefully some of it sticks. Don't hesitate to reach out if you have any other questions about anything. Sorry I didn't get a chance to get to this message until now, but I was sitting on the dock with a Tito's and tonic and just enjoying life. Love you guys. Talk to you soon.